ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ। ਪਲੱਗਇਨ ਵਿੱਚ ਤੁਹਾਡਾ ਸਵਾਗਤ ਹੈ। 2 ਮਈ ਤੋਂ 8 ਮਈ ਕੈਨੇਡੀਅਨ ਮਾਨਸਿਕ ਸਿਹਤ ਹਫ਼ਤਾ ਹੈ ਅਤੇ ਸ਼ੋਅ 'ਤੇ ਅੱਜ ਮਨੋਵਿਗਿਆਨੀ ਡਾਕਟਰ ਏਰਿਨ ਮੂਨ ਸਾਡੇ ਨਾਲ ਜੁੜੇ ਹਨ। ਮਾਨਸਿਕ ਸਿਹਤ ਅਤੇ ਗੁਰਦੇ ਰੋਗ ਵਿਚਕਾਰ ਦੇ ਸੰਬੰਧ ਬਾਰੇ ਗੱਲ ਕਰਨ ਲਈ ਅਤੇ ਜੇਕਰ ਤੁਹਾਨੂੰ ਕਿਡਨੀ ਦੀ ਬਿਮਾਰੀ ਦਾ ਨਵਾਂ ਪਤਾ ਲੱਗਾ ਹੈ ਤਾਂ ਤੁਸੀਂ ਇਕੱਲੇ ਨਹੀਂ ਹੋ। ਸਾਡੇ ਕੀ ਜਾਣਦੇ ਹੋ ਭਾਗ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਨੂੰ ਕਈ ਤਰੀਕੇ ਦੱਸਾਂਗੇ ਕਿ ਕਿਵੇਂ ਕਿਡਨੀ ਫਾਊਂਡੇਸ਼ਨ ਤੁਹਾਡੀ ਸਹਾਇਤਾ ਲਈ ਇੱਥੇ ਹੈ। ਇਸ ਲਈ ਕਿਤੇ ਵੀ ਨਾ ਜਾਓ ਕਿਉਂਕਿ ਇਹ ਸਭ ਅੱਗੇ ਆ ਰਿਹਾ ਹੈ ਇੱਧਰ ਪਲੱਗਇਨਸ ਵਿੱਚ।
In today's show, we're going to be speaking with registered psychologist Dr. Erin Moon about kidney disease and mental health, and we're going to explore the relationship between the two. We're going to talk about the prevalence, just how common are mental health challenges with kidney patients. We're going to look at some of those red flags, some of those warning signs. We're going to talk about coping mechanisms and strategies and when to consider seeking professional help and treatment. So we've got a jam-packed show. Don't go anywhere. We're going to be right back with Dr. Moon. Nice to meet you, Dr. Moon. Thank you so much for taking the time to be on Plugged In today.
Absolutely.
Thank you so much. So welcome, Dr. Moon, and thank you for joining us here today on Plugged In. Can you talk about why kidney patients in particular might face mental health challenges?
Sure, yes. So there are a lot of things to think about when it comes to chronic health conditions such as kidney disease. There's certainly a lot of stressors that go along with having a health condition such as CKD. So things like physical discomfort and pain, interrupted sleep, all of those things that are happening in the body. There can also be side effects from medications, frequent medical appointments that require people to miss work and school. So all of those are certainly stressors that can contribute to mental health challenges. And also, the anxiety and uncertainty that can come along with a serious medical condition. What are the next few weeks, months, years going to look like? All of those sort of fears and worries that come up when faced with a serious medical condition. There are also some direct impacts of the illness and treatment itself. So things like uremia, as toxins build up in the blood, there can be an impact on the brain. So, attention, concentration, mood can all be particular challenges as kidney disease progresses. And so we know that some of those things contribute. There can also be other things that go along with CKD, like anemia, for example. So when people have low iron, they might feel more fatigued. There might be a bit of an impact on their mood. So all of those things put people at an increased risk for having some challenges with their mental health. Children with CKD, just like adults, are also at an increased risk for things like low mood, depression, and anxiety. And with children, there are some specific issues as well. There can be a big impact on school. So when children are, at medical appointments or in the hospital, they're missing important lessons in the classroom. They're also missing out on opportunities to connect with their friends and learn and grow socially. So that can be a big challenge for children. We also know that lots of children with CKD and other medical conditions too can have quite a bit of anxiety about things like medical procedures. So even routine things such as blood work can become a really big source of stress for children. And then as well, for kids, it's really important to think about the impact on the whole family. So we think of the child in the family context. And so what are parents going through? What are siblings going through? What's been the impact on family relationships? So all of those things can be tricky for families of children or young people with kidney disease.
And how common are mental health issues among both the adult and children population?
Right. So we do have enough research to tell us that risk of depression, for example, is higher in patients with chronic kidney disease and who are on dialysis. So, for example, we know that rates of depression are 3 times as high in adults with end-stage renal disease compared to the general population. And so that's really quite concerning. We also know that there's research accumulating that risk of anxiety is higher as well. So we know more about adults in terms of the mental health impact of kidney disease than we do with children, but that is becoming more and more of a research priority. And so there is evidence building that young people with chronic kidney disease also have increased rates of depression, and some research to show that anxiety is also more prevalent in children and teens with kidney disease versus the general population. So it's important to note that the majority of adults and young people with chronic kidney disease are doing just fine in terms of their mental health and their relationships and that type of thing. But then of course there is a subset of adults and children who really do struggle and who feel very challenged in terms of things like mood and anxiety. So I think it's important to recognize that low mood or depression or a significant anxiety concern is different from just a normal reaction to a stress in life. So the reaction would tend to go on, for quite a period of time, so longer certainly than a couple of weeks. So if someone is feeling low and sad or very anxious, most of the day, more days of the week than not, and that goes on for a period of time, when we're into sort of many weeks or months, then that's an indication that people could really benefit from additional support. And the other thing to look out for too is just the impact on the person's day-to-day life. So if the struggle with mood or anxiety is getting in the way of getting to work or getting to school, doing normal activities that the person enjoys, if they're not able to do those things in the same way, then I would say that that's a red flag as well, for some extra support.
Let's see, so kidney is these are my grandpa's kidney stones. They're very precious. Kidney is a bone in your back that helps you turn.
I don't know, to be honest.
They don't know kidneys are vital, do you? Get the facts at kidney.ca.
And what about for children? Do we see similar red flags with children who are facing some mental health challenges?
Yeah, that's a really great question. So with young children, these things can show up a little bit differently. So, when we think about sort of going through the stages of development, the closer to adult they are, the more similar something like depression would look. So for a teenager, it might be quite similar to an adult. For younger children, though, they oftentimes show stress through body symptoms. So we might see changes in their eating, we might see changes in their sleeping, those types of things. There might be some complaints of body pains or discomfort, and that can be a way of the young person expressing that something's the matter, but they don't have the vocabulary yet to be able to say, I'm feeling sad or I'm feeling low. So we can see more of those body complaints. The other thing with children that we can sometimes see is sort of a withdrawal, sort of like a loss of interest in activities or things that they used to enjoy. So if they're no longer interested in going to their swimming lessons and play dates and that kind of thing, that can be a red flag for kids. And then interestingly as well, in children and teens, sometimes something like low mood or depression can show up a bit differently. So we might see things like irritability or mood swings versus that really sad, low, sort of tearful state. So that's another thing that parents might notice, another thing to look out for that might give an indication that the child is struggling. So this goes on for many weeks, many months, and to the level that it's getting in the way of day-to-day functioning. So the child or teen is not not able to get to class, get their homework done, get to their activities, that type of thing. So, if there's a really big impact on day-to-day functioning, then it's a sign that it's more than just sort of teenage ups and downs, which of course is understandable, and maybe moving more into the zone where some extra help or support might be helpful.
Can you talk about some common coping mechanisms or healthy lifestyle tips for people who are facing mental health challenges?
Sure, yes. So I think it's important to think about sort of going back to the basics. So things like healthy eating, prioritizing enough time for sleep, getting exercise is a really critical piece. And there's research that's growing to show us that exercise in and of itself can be really helpful for things like mood and anxiety. Also getting outside. For adults, it's really important to avoid drugs and alcohol, which might in the short term give some relief from things like low mood, but in the long term typically make it more complicated. Managing stress, reducing stress whenever possible, calling in your support system, seeing if there are some things in the course of your week that you could, give up for a period of time, doing things like yoga or meditation, whatever you do in your life to manage stress, anything that gives you relaxation. It can also be really helpful to connect with other people. So making sure that you reach out to your friends, your family, your support system. And so that might just be, informal, going for a coffee. It can also be more formal, like getting support from other people in the kidney community, through the Kidney Foundation, the different supports that are available. So all of those things can really go a long way to helping people manage stress, which then can have a positive impact on their mental health.
And in particular for children, what sort of tips might you have around some common coping strategies?
Yeah, I think one thing that's really great for families to think about is making sure that there's some open dialogue about feelings and emotions. So letting kids know that it's okay to talk about all kinds of emotions and that all kinds of emotions are okay. So, parents can really sort of set a model that it's okay to come to me and tell me that you've had a bit of a sad day or a bit of an angry day or that kind of thing, that's okay. That's a nice way for parents then to be able to check in and know how their young person is doing. And I think just as it is for adults, it's so important for kids to have good healthy eating, sleeping, activity habits, having a good solid regular day-to-day routine, just gives kids that predictability and helps them to manage stress that can come along with something like a complex medical condition. And also, again, finding ways for kids to connect with other young people their age, whether that's just their classmates at school or with other young people who have a medical condition. So things like the kidney camp. I can't tell you how many amazing stories I hear from kids about how much of an impact it can have to spend time, in the summer with other people their age who have gone through something similar. So that can be really helpful too.
Have you been newly diagnosed with kidney disease? Everyone's case is unique, but you are not alone. Many people can still find themselves overwhelmed when they are first diagnosed. For some individuals, it can be difficult to find answers to all the questions and issues they are facing. The Kidney Foundation of Canada is here to help navigate what living with kidney disease means for you. We can provide you with information, refer you to relevant educational resources, clinics, or other services, and offer emotional support. Check out the programs, services, peer support, and resources that are offered in your region. As a newly diagnosed kidney patient, you have just received a lot of information and it can all be overwhelming. So here's a few answers to common questions that you may have.
I have reduced kidney function. What does that mean exactly?
To be diagnosed with chronic kidney disease, you likely had blood work done that indicated your creatinine was a bit high and your eGFR was a bit low. These are the 2 kidney function tests. There are 5 stages of CKD, and all of this can be confusing. Call the local branch of the Kidney Foundation to speak to patient services staff and gain perspective on your own particular kidney situation. In BC or the Yukon, call 1-800-567-8112. The Kidney Foundation offers manuals and brochures that are available for free to either download off the website or to have mailed directly to you.
What foods can I eat?
Most meal plans for kidney patients are based upon the stage of the disease and the results of the person's blood tests. Ask your doctor if you need to limit or augment any minerals like potassium or phosphorus in your diet. You need to understand what your own nutritional needs are, and the staff of the Kidney Foundation branch may be able to assist with this. The Kidney Community Kitchen is a great online resource once you know what your dietary needs are.
Who can I talk to?
Please contact program staff at the Kidney Foundation to discuss your situation. Also, there is a peer support program if you would like to talk to someone who has been through a diagnosis of kidney disease.
How can the Kidney Foundation help me?
The Kidney Foundation have many programs and services that can help you navigate your new diagnosis. Although everyone's case is unique, remember that you are not alone. The Kidney Foundation is here to help. You may reach us by calling 1-800-567-8112.
When those sort of common coping mechanisms aren't working, at what point, I guess, should someone consider seeking professional help?
So I think, if those struggles like a low mood or anxiety go on for quite a period of time and it is getting in the way of day-to-day life, then it is time to think about asking for help and support. So for adults, a really important person to start with would be your family doctor. Also your kidney care clinic team. Those are all really good sources of information and resource, those members of your team can certainly direct you to other resources that exist in your area that can help with mental health. Some people can access counseling through their employee assistance program, so that can be something really helpful for adults to look into. And then when it comes to crisis services, it's also really important to know that those exist 24/7. So, in your local area, there will be crisis services and crisis lines that can click in if someone really needs in-the-moment support. So for children, again, family doctors are a great source of information, or a pediatrician, and that's a really great starting place.
So Dr. Moon, can you talk a little bit about your role here at BC Children's?
Sure, yes. So I have the opportunity here at BC Children's to work with the renal team as well as the multi-organ transplant team. And so these teams care for babies all the way up through young adults, age 19. In our province who have kidney disease, who are on dialysis, and then who have had an organ transplant, including a kidney transplant. And so I'm part of a big interdisciplinary teams. Those include physicians, nurses, social workers, dietitians, physiotherapists. There's a really big team, lots of different disciplines around the table who provide that sort of wraparound view of the child's health. And so luckily, in each of those teams, there really is a big focus not just on how the child is doing medically, but what is their quality of life. So, how are they doing at school? How are they doing in terms of their emotional well-being? How are they doing in terms of their relationships? And how is the family doing? And that makes sense because we know that all of those things really impact how the child is doing medically as well. So when you address things like mental health concerns in young people with chronic kidney disease, their medical outcomes improve as well. We know that for both children and for adults. And so I'm really lucky to work in this team, in these teams where there really is that holistic focus. So, how is the child doing in terms of all of those aspects of their life? And that the goal is not just treatment of the medical symptoms, but getting them back to more, as full and fulfilling of a life as they can have.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
So can we talk a little bit about what actually happens when a patient comes to see you in your clinical setting?
Yeah, so for me, I'm lucky enough to work with preschoolers all the way to young adults. And so what a meeting with a psychologist looks like really depends on the age. So when it's a young person, I would typically spend some time one-on-one with parents, collecting a lot of information. So I always have lots and lots of questions about the family history, the child's early life and development, and then the parents are the experts on how their child is doing. So what are their concerns? What have they noticed? What's most on their radar? And then when it comes to meeting with the young person themselves, if it's a really young child, we might spend some time in our play therapy room, for example, and it's less talking and more play, art, giving them ways to express themselves the way that kids do. And then when it's an older child or a teen, it would look more like a talking type of session. So again, lots of questions about how they're doing, things that are stressful to them and what's most on their mind, areas of challenge. And then after that assessment phase, really working with the family to determine what are the goals. So, out of all the things that we've discussed, what are the pieces that are of most concern, and coming up with a list of goals for the work. So it's quite typical for me to meet with a child on a weekly basis. So we might meet once a week for an hour-long session. I also do things like go up to the renal dialysis unit and meet with young people at the bedside. We might only be able to sneak in a half an hour, during their hemodialysis run or that type of thing. So it's very flexible. It takes a lot of flexibility and creativity, but that's part of what makes it fun. So, it's really just a matter of tailoring an intervention for that family, for that child, and what they're going through in terms of their medical condition.
And so you might see a child from a very young age, say before they've even started dialysis, all the way through to post-transplant.
Yes, I'm lucky enough to be able to work with both the renal program and the transplant program here at Children's. And so, yes, I've certainly followed families, children over periods of many years. And so there are some families who I met when the child was in the chronic kidney disease program who then might move to dialysis and then into their post-transplant care. So it's really nice to have that continuity, and different issues and challenges present themselves at different points in that journey. But I'm really glad to be able to have the privilege to work with them over time as they go through this really long journey here at Children's Hospital. Yeah.
So Dr. Moon, can you talk a little bit maybe about some of the treatment options for patients with kidney disease who also have mental health challenges?
Yes, certainly. So treatment for things like depression and anxiety in people with complex health conditions really look about the same as they do for the general population within a framework and a context of the medical condition. And so, when we're thinking of something like depression, for example, when the symptoms are in sort of the mild to medium range of severity, really what we look at is therapy as an option first. And so cognitive behavioral therapy is one of the most evidence-based interventions for both adults and for children with things like low mood or depression. Of course, it looks a bit different with adults and with kids it's much more play-based and free-flowing. But really that type of work is all about the connection between thinking, feeling, and behaving, and how that all goes together to impact mood. When you move more into the sort of medium range to severe range of symptoms, At that point, it's a consideration whether there might be an additional medication that could be helpful. And usually it's a combined approach of medication and therapy together is what the evidence shows us has the best impact. And so, it's quite common for me to ask my psychiatry colleagues here at Children's Hospital to consult with a family to see whether or not a medication might be appropriate. And some family doctors and pediatricians are also experts when it comes to those types of medication options. So there's a lot of consultation and interdisciplinary work when symptoms are really troublesome to a child's or an adult's day-to-day life. And oftentimes that combined approach of therapy plus medication is the package we need to put together to get them some relief.
Well, Dr. Moon, we've covered a lot of ground, but one last question that I did have. Are there any recommended resources out there for kidney patients who are facing mental health challenges, maybe for parents who've got children with kidney disease who are also facing mental health challenges?
Yes, absolutely. So there are a couple of key websites that I can recommend. There's so much on the internet these days, and some of it is good and some of it is not as good. So there are a couple of key places that people can go that can then sort of be a hub for connection with other resources. So for adults, the Anxiety Canada website is a really great source of information. And actually, both for adults and for children, they have resources that are really across the age span. So if there are concerns about anxiety, certainly Anxiety Canada is a great source of information. The Canadian Mental Health Association website is another really great source of information. And there's some really great programs that are offered through the Canadian Mental Health Association. Things that are quite unique, like telephone coaching and online services. So certainly the Canadian Mental Health Association is a good source of information. And then the other one specifically for children and youth is the Kelty Mental Health website. And the Kelty Mental Health Resource Center is housed here at Children's Hospital. They have an amazing website. They also archive things like expert presentations, webcasts, things like that. And so that's another really great source of information around really, mental health broadly in young people.
Well, thank you for all that. This has been extremely informative and I know for our viewers, very, very helpful. So I thank you so much for your time today, Dr. Moon.
It's my pleasure. Thank you very much for having me. So we have all kinds of play materials.
Toys.
Yeah, we've got arts and crafts materials. Behind you there's a dollhouse with different dolls and figures.
Putting them at ease.
Yeah. So very play-based, particularly with a younger child. And then, we have some things that I might be using quite often. So for example, we've got our little Dr. Bear MD.
Very cute.
And things like a play medical kit.